Good afternoon, everybody. We've got some folks still joining. We'll give them just a few minutes to get connected, and then we'll get started. You know, what's good to know, Karen, is you're probably going to have more attendees than the Braves did at their last home game.
I see the number is increasing, so
yeah, they're picking up. They're picking up. That's for sure. So, yeah, you're one of the most popular venues in town today. So that'll be good.
Oh, okay. So, are you doing the different payers every day? A different payer every day?
Yep. We've had a different payer every day. Yeah, we sure have.
Okay.
Somebody says, "Hey, Carl." Carl Guyden says, "Hey, Karen."
Hey, Carl. Oh my God. Yep. Carl used to work at Humana, and then he left Humana and he went to United, and now he is, I believe, at Harbin. So,
okay.
Yeah.
Great. Very good. Very good.
Small world.
Absolutely. Yep. Let's give it just a minute here. We got, looks like a few more dialing in. Okay, if it's all right with you, it looks like we'll go ahead and get started. That number's staying about the same right now, so I appreciate it. So good afternoon, everyone, and welcome back to day 2 of the Georgia HFMA Virtual Payer Forum. My name is Bill Eikest, and I am the moderator for this week's forums. We appreciate you joining us. I trust that you're all doing well and managing through this challenging time as best as you can. Many of us are working from home, which is a little different, but it's kind of certainly our new normal. So it's, of course, my preference to always meet in person, and most of the speakers this week said that they would always love to meet with us in person, but current times have forced us to think a little differently, but we still believe that the value of this payer forum is important enough where we still wanted to host it. So Georgia HFMA, as you know, has a long-standing commitment of cooperation and collaboration with payers around the state. And this is an opportunity for us to continue to keep the lines of communication open with payers and with providers. I know there's been a lot happening. So we're going to give you the opportunity to interact with the folks from Cigna today. So here we are. Each day this week, as you know, we have a different payer. Today is Cigna. Yesterday we had Palmetto GBA, and their presentation will be out on the website, Georgia HFMA website, sometime later this week or early next, along with the recording of the webinar. And we've got United Healthcare tomorrow. We've got DXC Medicaid on Thursday, and we've got Ambetter on Friday. So I hope you can join us. If I would ask you at the bottom of your screen, for most of you at the bottom of the screen, there's a Q&A section. As we go through the presentation, if you have any questions for the speakers, please include your questions in that section. Do not include, of course, any PHI in your question, but anything that they might be able to assist with. Cigna is giving us an overview from the their Medicare product today, as well as their commercial product. We've got about an hour set aside, roughly 30 minutes for each, which should also allow time for questions. So presenting for Cigna today, we have Karen Andrews. Karen is a longtime supporter of Georgia HFMA. She's been kind enough to do these presentations with us before. And we've also got Rotunda Simmons, who will be speaking about Cigna on the commercial side. So welcome to all of you attending today. I'm sorry we don't have snacks and drinks and all that good stuff, but maybe we'll get back to that for the spring. But it is a good day. How about those Atlanta Braves getting to win one in the championship series last night? So
absolutely,
we certainly have something to smile about, and I think these ladies will give you some good information today their presentations will be on the Georgia HFMA website under media in the in case you missed it section. So I will turn it over now to Karen and Rotunda. Any questions, please put those down in the Q&A section of your screen. Thank you so much.
All right. Thank you, Bill. Thank you so much for having us. Typically, I prefer to do these type forums in person, but due to the pandemic, we're having to do it virtually. So bear with me. I am a little nervous. I normally don't get nervous when I'm speaking, but because this format is a little different, I am a little nervous. So we're going to go ahead and begin. My name is Karen Andrews, and I will be representing the Cigna Medicare. Who are we, you may ask? I'm sorry. Who are we, you may ask? Cigna is a global health services company with 125 years of service. We're dedicated to improving the health, well-being, peace of mind to those we serve. We have more than 180 million customers in more than 30 countries and jurisdictions with over 70,000 employees, like myself, who are dedicated to living our mission and being champions for our customers and communities. We are champions for affordable, predictable, and simple healthcare. Last year, we dropped the Cigna HealthSpring brand for our Medicare Advantage and Medicaid businesses, uniting under the well-known Cigna brand name, therefore making us one Cigna. Attached is a map of our coverage area. We offer Medicare Advantage HMO plans, HMO point of service, HMO dual special needs plan, and PPO plans in counties throughout the metropolitan Atlanta area. Cigna Medicare has positioned ourselves very well. We're offering stability. We're making it affordable with many $0 to low premium plans. And over 90% of our renewing plans have stable or declining premiums, making it predictable by taking the surprise so people are able to make informed health care choices. Making it simple. We make it easy for the people we serve to get the care that they need. Some of the Medicare Advantage highlights for 2021, no out-of-pocket expense for behavioral health. And this is for all our Medicare Advantage patients. No out-of-pocket expense for mental health or psychiatric care. Customers' mental health is important to achieve the whole person health. There's no cost for online wellness resources. There's a variety of topics, anything from A to Z, such as fitness and exercise through the Silver and Fit Healthy Aging and Exercise program. This program offers a gym membership or at-home services. Primary care physician visits and behavioral health are currently offered through telehealth. Effective 2021, we will offer telehealth for physical therapy services. Also for 2021, we have a dental allowance. The allowance amount will vary depending on the dental plan that is selected by our members, but the allowance can range anywhere from $500 to $2,000. Some of our Medicare plan names are changing in 2021. Just to name a few, the Cigna HealthSpring Advantage HMO plan will be referred to as the Cigna Fundamental Medicare HMO plan in 2021. The Cigna HealthSpring Preferred Plus HMO will be referred to as Cigna Preferred Plus Medicare HMO. And the Cigna HealthSpring True Choice PPO plan will be called the Cigna True Choice Medicare PPO. This is, of course, due to the dropping of the Cigna HealthSpring brand. Attached is a copy of our ID card. This is the True Choice plan, the PPO ID card. Our HMO card is identical to what you see. However, the HMO cards will have the name of the primary care physician listed on the ID card. Okay. Express Scripts Pharmacy is a Cigna company, and it is our preferred mail order pharmacy for our Cigna Medicare Advantage Part D and prescription drug plan patients. By utilizing our mail order pharmacy, our members can receive a 90-day supply of Tier 1 and Tier 2 formulary drugs at no out-of-pocket expense. So the benefit of a 90-day supply, you're not having to go to the local retail pharmacy every 30 days to get a prescription refilled. You can order a 90-day supply, have it delivered to your home. So not only will you save a little bit of time, you'll also save some gas as well. Express Script Pharmacy also offers the extended payment program. This allows patients to pay for their 90-day home delivery script, copay, or co-insurance, depending on their plan, over a 3-month time period. Just to highlight a few of the changes for the pharmacy benefits for 2021, there will be a change in a $10 increase for the deductible, and the initial coverage limit is increasing by $110. Just wanted to point that out, just in case if any of your patients ever have any questions. MedicareProviders.Cigna.com provides a wealth of information. One of the features includes the drug and pharmacy search tool, where our members are able to locate participating pharmacies and cost compare medications. Our diabetic patients are a great focus for us as an organization, and one of the ways we want to see success for our diabetic members is we offer free diabetic testing supplies. $0 for preferred meters and test strips. The Lancets, the cost will vary depending on the plan, but there's either no out-of-pocket expense up to a 20% co-insurance. And these are some of the examples of some of the brands where the patients can receive free meters. Giving you a chance to look that over. Okay. Low income subsidy is available for those patients who may need some extra help. This is a federal benefit provided by the Social Security Administration. Attaches the application and screening support resources. So if any of your patients identify that they need some additional assistance and they are covered under a Cigna Medicare Advantage plan, if you could refer this information to them, we would greatly appreciate it. And again, as Bill mentioned, copies of the presentation will be provided, so you don't have to worry about trying to write down any of this information. It will be included in the presentation. Okay. In closing, I would like to sum up now how we help you as our participating providers and how we help our patients. At Cigna Medicare, we are a leader in health services, committed to helping our nation's Medicare and Medicaid beneficiaries live healthier lives through personalized, affordable, and easy-to-use healthcare solutions. Due to the COVID-19 pandemic, we were the first payer to waive customer cost share, and this was for any COVID-19 related services and non-related services. We are unique in our support of the doctor-patient relationship through innovative clinical and customer-focused engagement, care coordination, and detailed analytics. Our collaborative approach as a Medicare Advantage plan is to work closely with doctors to monitor and analyze patient data. As a plan, we recognize and reward providers for quality, not quantity, of care, and focus more on resources through innovative technology. The way that we incentivize our providers through our different 360 program or provider partnership for quality program, they are eligible to earn up to 125% of Medicare. Our key metrics are centered on coding documentation through the submission of our annual 360 exams, and completing those, they are incentivized for doing that. The 360 exam captures all chronic conditions and specific HEDIS measures, and our Partnership for Quality P4Q program ensures patients receive access to a team of healthcare professionals working together daily to deliver preventative healthcare, driving star metrics for each of our participating providers. Cigna Medicare brings a different approach to the industry with positive results, providing solutions to healthcare challenges. We believe in delivering better care in partnership with our participating providers, better health for our customers, and better savings to our country's healthcare system overall. At this point, that is the end of my presentation. And Bill, are there any questions?
Thanks so much, Karen. We'll give a couple minutes here for people to submit any questions for you that they might have.
Okay.
I'm putting you on the spot here a little bit. If you're not prepared to answer, don't worry about it. But are there any particular issues that you hear about from providers that that maybe there's a simple solution to, or directing them to a particular resource where they can get some of the answers? Are people trying to go through the old means of communication when maybe some of that information is available on the website or through the portal?
MedicareProviders.cigna.com is our website. There is tons of information out there, whether it's regards to the COVID-19 or not. There are a lot of frequently asked questions out there, but if there's anything specific, you can direct those to me, and I can work with our team to make sure that we provide them with answers. But there is a lot of information out there.
Okay, that's great. Let's see. And I've got one comment here. Do you have Mike Lindo works with you?
Oh my God. Yes. Hi, Michael. Oh my God.
So he has he has a more detailed question on Cigna products. You can contact him. Can you see in the chat there the information to all the panelists? His number's in that chat. If you can,
okay, let me.
Yeah, if you can just maybe follow
yes,
up.
I will. Yes, I will do that. I worked with him at Cigna years ago.
Oh, okay. Yeah, great. Yeah. So follow up with him. He's got a more detailed question for you. And then
okay, we'll do.
I don't think we have any additional questions that have come in. So you're going to drive the presentation here for Rotunda on the commercial side.
Yes, I am.
Yep. I want to welcome those of you who maybe joined us a little bit late. Karen just went through the Cigna Medicare portion of the presentation, and now she's going to turn it over to Rotunda Simmons, who is going to talk with us, with you more on the commercial side. If you have any questions during their presentation, I would ask you to submit your question down in the Q&A button that should be on your screen, on your phone, however it is that you're watching us, and we will go from there. So, Karen, when you I think when you share your presentation, it'll probably push you off the screen. Oh, okay. There you go.
Can you see it now?
Yeah. Go ahead and turn your camera off and let me see what happens, just so that we've got Rotunda on there.
Okay. Hang on. Stop video. Okay. It is stopped. All right.
Yeah. And I think, and so we've got Rotunda on there now. And okay. You're going to drive her presentation there. So
slide.
Can I stop real quick and
yeah.
ask you a question?
Huh?
Somebody had a question. Let me give it to you real quick, okay?
Okay.
On those procedures where prior authorization is not required, but a place of service is required, is your process policy for provider services calls to obtain a prior authorization to inform the provider of the provisions for both the procedure and place of service? If not, why not? You need me to
Okay.
reread that?
Well, it's my understanding, they're asking if a pre-certification is required for a place of service.
A prior authorization is not required, but a place of service, so a site, is required. Is your process policy for provider service calls to obtain a prior authorization to inform the provider of the provisions for both the procedure and place of service? If not, why not?
So the best thing I could advise about that is there's a total listing of outpatient procedures. Inpatient services will require prior authorization, but there is a listing of all outpatient procedures that require prior authorization, and that is also available on our Cigna site.
Okay. And then a follow-up question. For appeals, please clarify 180 days from which denial, initial or final?
180 days from the last, either the appeal date when that was complete or the date of service, that last date of service. So if you had to submit a corrected claim, it will be 180 days from that last corrected claim or that last claim.
Okay.
That date of service.
Okay. Hopefully that answers the question.
And Sharice, correct me, keep me honest here if I'm misspeaking something. Okay, and now we will go to pre-certification. All network participating providers are required to, of course, utilize other network participating services for Cigna patients. And all inpatient services and certain outpatient services require pre-certification. You can call Cigna customer service at the number listed for all pre-certification requests. And the standard turnaround time is 72 hours. That's standard. It's not going to always work out that way, but that is the standard turnaround time. And as I mentioned, you can find a complete listing on our website of those outpatient services that require pre-certification. You can also add or delete services that were previously pre-certified by calling Cigna customer service. And it's got the number right there, that customer service number 877 number above. Okay. And here's a listing of all of our national ancillary providers that Cigna uses. Evercore, which we use for high-tech radiology and diagnostic cardiology services, and there's contact information over to the right. CareCentrix, and I need to note that only through January 31st will we continue to use CareCentrix. That's for DME and home sleep study services. Their contact information is to the right. Effective February 1st, 2021, Evercore will be responsible for home healthcare DME and home sleep study services. And Evercore Healthcare, their contact information is also listed to the right. And as noted, that will become effective February 1st, 2021. Okay, slide 11. Okay, patients with Cigna coverage may receive network laboratory services from any provider in the Cigna OAP network. National network labs for Cigna patients are LabCorp and Quest. Cigna must be notified of inpatient admissions, and a pre-cert is required at least 2 days prior to admission for elective admissions unless applicable state mandates determine otherwise. Emergency admissions, including observation admissions, require notification within 1 business day of the admission unless it's mandated differently. Slide 12. So here's a sample of our ID cards. You can see the third-party logo would be there up at the top, TPB logo. Next to that would be a client-specific logo, as well as the client logo on the end at the top on the right corner there. And on the back, there's admission procedure information as well as claims mailing addresses and contact phone numbers. And then of course, in the middle, you see the patient information, ID number, PCP if they selected one, and to the middle off to the right, thank you, Karen. It gives you the copay information and co-insurance information for the patient. And we can go to the next slide. And slide 13 is just another example of our HMO open access or point of service open access cards, displaying that same information. Okay, and 14, okay, this slide is a little small, but next we have information concerning our Local Plus network. Thank you, that's much better, thank you. Local Plus is a facility-driven network which provides local access to providers, including various specialists and facilities. And these specialists and hospitals, they're located right where the patients live. It's a very local network. To be in the Local Plus network, providers must have admitting privileges at a Local Plus facility. As far as providers groups are concerned, all of the providers within a group must meet the network criteria. The group is either all in or all out. There's also a breakdown of how Local Plus plans work. We have the regular Local Plus plan, and that's right here to the left underneath the banner Local Plus Network. We have the regular Local Plus plan, which is which has in and out of network coverage. While the Local Plus in only has in-network coverage. And I hope I didn't confuse people. So the regular Local Plus has in and out of network coverage. Local Plus in only has in-network coverage. Both have in and out of network coverage for emergencies. Primary care physician selection is encouraged for both, although it's not required. And no referrals are needed for either, and you can access the directory for both. In fact, for all of our plans at Cigna.com. And to the right, it shows you, we have a listing of the Local Plus facilities, current Local Plus facilities, and then there's a geographic map showing where a Local Plus network is active here in Georgia, available here in Georgia. And then there's another sample of the Local Plus ID cards to the bottom, yes. And so now I've reached the end of the presentation. So if we could see who has any additional questions, and I'll make sure that Sharice is on point to assist with those, but any questions?
Thank you so much, Rotunda. Great job. Let me go back to that prior authorization question. I don't think I asked it correctly. So
okay.
The person that submitted it has restated it. Does EviCore issue prior authorizations for both the procedure and the place of service? If not, why not?
So EviCore, if they're handling the prior authorization, they would handle the whole process. So EviCore would totally own that process. EviCore would totally own that process. Okay, I'm sorry, go ahead.
No, this is Sharice. I was going to say you're absolutely, yeah, that's correct, Rotunda. When they do an authorization, they would do that authorization based on both. So if sometimes there's denials and they're based off of place of service. So yes, they would handle it in totality.
Okay.
Okay. All right. Let's see. Let me just make sure I didn't miss one here. Any updates regarding telehealth that you can share?
No, I know there's quite, as expected, there's quite a bit more telehealth visits and services being offered and done by providers. And we have, in reference to COVID, and any available and updated information will be provided on our Cigna for HCP website under our COVID response page,
Okay. But you know, some of the payers have extended the benefits through at least the end of the year.
Yes, we have extended the benefits to 12/31/2020.
Okay,
Mhm.
okay. I'm sorry, just to follow up on the prior authorization. So Evacor would also assume responsibility for the appeal on those denials for procedure or place of service?
No. Now, the appeals process is owned by Cigna. Appeals will need to be submitted to the appeals address as listed on the patient's card or the appeals address found on our website. But we would own the appeals process, and of course, we would coordinate any information needed and get that from Evacor. But the appeals process is handled by Cigna.
Okay, okay. I would ask the person that submitted the question, if you need some additional detail around that, feel free to email me. My email was in the registration, and I'll be glad to share that with Rotunda and with Karen, and we'll get whatever additional information you might need back from them.
Yes.
Yeah, that would be good, because it sounds like they have maybe have some specific questions that we can just drill down and help answer. So yeah, that would be good.
There was just the concern that there may be a disagreement between Cigna and Evacor as it related to the prior authorization. So
Understood.
Okay. Hang on here. Let me make sure I'm covering everything. We got a couple more questions. I think that should just about cover it. Folks, last call for any questions that you have for our presenters from Cigna today, either on the Medicare product or on the commercial side. We did have someone ask again if the presentation will be available. Let me take back my screen. I'm gonna stop screen sharing with you all here real quick and just. So this is a picture of the Georgia HFMA website. What you're going to do is you're going to come down to media right here. You're going to go down to the document library. You're going to click on that, and you'll see down here is in case you missed it section. Click on that. You'll go to 2020. We don't have it set up yet, but we're going to have a virtual fall payer form set up folder under this. So under 2020, it will have that, and the presentations from this week will be included in that folder. I noticed while we were going through the presentation, I'm pretty sure it was with yours, Rotunda. I apologize, but it looked like I had maybe somehow inadvertently stopped recording. So I resumed that, and so the recording for this particular session is likely to be a little bit spotty, but I apologize for that. So the other thing I wanted to show you on the HFMA website, we've got a lot of events going on in HFMA Region 5, and you can click on events and education and scroll down to see the different events going on. There's another event next week is another virtual forum that's going to cover several different topics. And then I would remind you to look for the virtual fall conference for Georgia HFMA coming in November. I believe is November 4th and 5th. So look for details on that, but a lot of good education. Obviously, we're really trying to continue to keep you connected, provide you with information that you think is important, and have a little bit of fun along the way too. So that's certainly good. But ladies, I want to thank you all so very, very much. You did a great job today, and we appreciate it so very much. I want to take just another minute to thank the Georgia HFMA corporate sponsors who continue to support the organization and the association, and especially during this time. Those sponsorship dollars are so important to allow us to still provide support and education and networking opportunities to our members and keep us all connected. I know me, for one, is looking forward to the opportunity to get back together with everybody in a room. I think I'm just going to set up a hugging booth and reconnect with everybody. But I know many of you on today's call are busy on the front lines of your organization, following up on claims, billing claims, and just trying to get the dollars in for your organizations, which is so important right now. And I would quote something that I saw just recently, and it said, life is like riding a bicycle. In order to keep your balance, sometimes you just have to keep moving. And so I would encourage all of you to keep pushing forward. And as our current chapter president, Lawrence Harris, would say, everything's going to be okay. And we're going to get through this. But I know your organizations would say they certainly couldn't do it without each of you. So keep pushing forward. Don't hesitate to bring issues to people's attention as it relates to the different payers. We hope to see you tomorrow on the call with United Healthcare, also at 1 o'clock. If anybody knows of anyone having any trouble accessing the presentation or the webinar today, please have them reach out to me, and we'll try to make sure that they don't miss any of the ones for the rest of the week. But I think this was valuable. I hope it was valuable for you, and Georgia HFMA really appreciates your continued support. So thank you to the folks from Cigna. Thank you to all of you who attended today, and we look forward to your continued participation this week.
All right.
All right, thank you.
Everybody
Take
have a
care.
great
Thanks so
day.
much.
Bye-bye.
Thank you, bye.